about a treatment that we do every day in our clinics. It's called Fraxel Laser. What is Fraxel and how does it work? Well, Fraxel is a fractionated laser, and how it works is it puts pinpricks of laser energy into your skin and creates a heat injury that sits below the surface. What this means for you is that your skin produces a lot of collagen and elastin and hyaluronic acid in the healing phase from that injury, as well as purges or removes all of the dead skin cells, so it resurfaces the skin. Who's Fraxel for? Well, the great thing about Fraxel is that it can treat all ages and all skin types, even traditionally more difficult Asian skin. We treat sun-damaged skin a lot with Fraxel Laser. So anyone who's noticed that their skin has been prematurely damaged from the sun and has lost its collagen or elasticity and looks a little bit older and has some wrinkles, and also pigmentation. We can also even treat scarring with Fraxel Laser. What's the experience like? This is a question clients ask me all the time. What happens when you come into our clinics is that we're going to do a thorough consultation. We're going to look at your skin below the surface. This is absolutely crucial because there are certain clients that Fraxel is not suitable for, and that's not always obvious by just looking at the surface of the skin. When we have a look at what's happening below the skin, we can decide if Fraxel is right for you, but it will also help us in terms of what treatment settings we put you on and how much of the skin we actually do injure. When you come in for your Fraxel treatment, we'll put topical analgesia on the surface of your skin, and this analgesia will numb out most of the sensation. It'll feel like hot little pinpricks on the surface of your skin, and while clients say it's not exactly comfortable, it certainly is tolerable. After the treatment, you feel like you've had a really bad sunburn, and you can have that heat in your skin for about 2 hours afterwards. It settles down after that. The downtime is a question that I get asked all the time, and I always say to my clients, it's social downtime. You can certainly go about the activities of daily living you otherwise normally would, but if you don't want anyone to know that you've had a Fraxel treatment, then you've probably got to stay out of the public eye for about 3 to 4 days. The day after a Fraxel laser, your skin is still very red and there's a little bit of swelling there, but this dissipates during that day. The redness stays for about 3 to 4 days, and at about day 4, you're going to notice that your skin feels quite rough. That roughness that you feel is where your skin is purging or getting rid of all of the dead skin cells and bringing them to the surface, and is part of the resurfacing part of this particular treatment. So that roughness is going to stay for about a day or two, and then you're going to notice that you are shedding some dead skin cells. The great thing about this is what is left is healthy, fresh, vibrant skin, and isn't that what we all want? I love this particular treatment because you get a great result immediately after, but you still produce collagen at an accelerated rate for months and months post-treatment. The other most common question we get is how many treatments do I need and how often do I need to have them? That totally depends on your situation, and that's something that we can help you identify at the consultation. It's very different for each individual. What I generally say though is that some of my clients will do 2 to 3 treatments spaced 6 weeks apart, while other clients will simply do it once or twice a year. So what do you need to look out for when you're having a Fraxel treatment? The most important advice I can give anyone is have a thorough consultation. If you are having a consultation and they are not using skin imaging software to look below the surface of your skin, do not proceed with the treatment. It's the clients that we say no to that are just as important as the clients that we say yes to in this particular treatment. If you have any questions at all about whether Fraxel might be for you, please contact us at the clinics or visit our website.